Your doctor looks at the number, 90, and they smile. They actually smile like you passed a test, like you did something right, and you walk out of that office feeling good about yourself, maybe even a little proud, because 90 is the number everyone says you want. 90 is the goal. 90 means you're doing it right. But I need to ask you something. How do you feel? Not how the number looks on paper, not what the chart says, not what the machine reads at 7 in the morning when you haven't eaten yet. How do you feel? Because there's something I've been watching for years. Sitting across from older adults who have beautiful fasting blood sugar numbers. Perfect looking A1C. Everything the guidelines say is good, and yet they're shaky, they're confused, they're falling. They're exhausted in ways they can't explain. They keep saying, I don't know what's wrong with me. My numbers are fine. My doctor says I'm fine, but they are not fine. And that gap between the number that looks right and the body that feels wrong, that gap is what this video is about. I'm Dr. Anton Wards. I've spent years working with older adults, patients in their 60s, 70s, 80s, people navigating diabetes, medications, multiple conditions, and the quiet, complicated reality of getting older in a medical system that was never entirely designed with them in mind. I love this work. I genuinely do. But there are things I wish I could say more clearly, more loudly, things that get lost in the 15-minute appointment, in the referral sheet, and in the follow-up blood work that comes back and gets filed and nobody calls you about unless something looks alarming. So I'm saying them here because some of you are chasing a number that may be hurting you, and nobody told you that. Here's what I need you to understand. The idea that lower blood sugar is always better, that idea was not built for you. It wasn't designed with a 74-year-old body in mind. It wasn't written for someone managing 3 medications and eating smaller meals, and maybe not sleeping quite right and living with the kind of fatigue that doesn't really go away anymore, the kind you just learned to carry. The rule was built on research done largely in younger populations, general adult populations, and somewhere along the way, it got simplified, flattened into this clean, easy message. Lower is better. Get it down, keep it down, 90, 80, even lower if you can manage it. And that message spread. Doctors repeat it, patients internalize it. Families worry when the number ticks up even slightly, and nobody stops to ask, wait, is this target right for this person, for this age, for this body? Nobody asks that. And what happens when that rule gets applied too aggressively to a body that is older, slower to respond, more vulnerable to the fall, literally? That can come from pushing blood sugar too low. I'll tell you what happens. The body tries to warn you, and sometimes you don't hear it in time. Let's talk about what actually changes in the body, because your body at 70 is not your body at 40. That's not a criticism, that's just biology. And if we're going to talk about blood sugar targets, but do we have to talk about the body those targets are living inside? After 60, the hormonal response slows. When blood sugar starts to drop in a younger person, the body fires back fast. Glucagon surges, adrenaline kicks in, the liver releases stored glucose. There are symptoms, shaking, sweating, heart racing, and those symptoms tell the person, eat something. Right now, in older adults, that response can be quieter, slower, sometimes it barely shows up at all. The warning signals get muffled. And that's dangerous because by the time an older adult realizes something is wrong, the blood sugar may already be quite low. The gap between feeling a little off and being on the floor can be much smaller than it used to be. There's more. Muscle mass decreases with age. Muscle is one of the main places the body stores and uses glucose. Less muscle means less buffer, less capacity to absorb a blood sugar swing before it becomes a problem. Appetite often decreases too. Older adults frequently eat smaller meals, less consistently, sometimes skipping meals entirely, not out of choice, just not hungry, not feeling it. When you're eating less and your medication was calibrated for a different eating pattern, that medication can push blood sugar lower than anyone intended. And the kidneys. The kidneys change with age too. They filter medications differently. Certain diabetes drugs stay in the system longer in older adults, which means the medication keeps working, even when it shouldn't be working quite so hard anymore. All of these things together, the slower hormonal response, the reduced muscle mass, the smaller appetite, without the kidney changes, they create a body where aggressive blood sugar lowering carries real risk. Risk that wasn't there 20 years ago. Risk that the guideline written for a 52-year-old doesn't fully account for. So when someone hands a 78-year-old a target of 90, and that person takes their medication faithfully, eats carefully, does everything right, sometimes doing everything right is exactly what causes the problem. I want to ask you something personal, and I want you to really think about it before you move on. Do you ever feel shaky between meals? Weak in the morning? Not just tired, but weak, like your legs aren't quite sure they want to hold you up. Sweaty when you haven't done anything to sweat about. Suddenly anxious, suddenly irritable, and you don't know why. You weren't upset about anything. And then 10 minutes after eating something, it passes. Do you feel foggy before lunch? Like the words are there, but they're just a little slow to come, like the room is slightly dim even when it isn't. Do you feel better, noticeably better, after eating something sweet? If any of that sounds familiar, I need you to keep watching. Because what you might be calling just how I feel now, or just getting older, or just one of my bad days, might not be any of those things. There is research on this. I want to be clear about that. This isn't opinion. This isn't one doctor going rogue with a controversial idea. There is real evidence, published, peer-reviewed, discussed in geriatric medicine, showing that in older adults, aggressive blood sugar control can increase the risk of hypoglycemia, low blood sugar episodes, and in seniors. Hypoglycemia is not a minor inconvenience. In a younger person, low blood sugar is uncomfortable, unpleasant. You feel terrible, you eat something, you recover, you move on. In an older adult, it can mean a fall, a fracture, a hospital, cognitive decline, a heart arrhythmia triggered by the stress of the episode, a nighttime low that nobody catches until morning. Some studies looking specifically at older adults with diabetes found that trying to hit very tight glucose targets that might be completely appropriate for a 45-year-old, was associated with more hospitalizations, more serious adverse events, not fewer. Let me say that again because it matters. In some older adults, tighter control led to worse outcomes, not because they weren't trying hard enough, not because they were doing anything wrong, because the target itself was wrong for them. So when you see that fasting blood sugar of 90 and you feel proud of it, I want you to ask one more question. What did it cost me to get there? Did the medication that got you to 90 also leave you weak at 10 a.m.? Did it leave you shaky by dinner time? Did it make you afraid to leave the house without snacks in your pocket because you never know when the shakiness will start? A number that looks perfect on paper can be making your actual life harder, weaker, less safe. That's the part nobody tells you. Now I want to be very clear about something because I can already hear the question forming. Does this mean high blood sugar is fine? Does this mean I should just let it run high and not worry about it? No. Watch, that is not what I'm saying. Chronically high blood sugar causes real damage to eyes, to nerves, to kidneys, to the cardiovascular system. That damage is real and it accumulates over time and it matters. I am not telling you to ignore your blood sugar. What I am telling you is this: the best blood sugar target is not the lowest possible number. It is the right number for your body, your age, your medications, your kidney function, your level of frailty, your eating patterns, your life. And that number is not the same for everyone. A 45-year-old with well-controlled type 2 diabetes and no other significant health issues might genuinely benefit from very tight glucose control. For them, aiming for 90 might be exactly right. A 76-year-old managing diabetes alongside heart disease, reduced appetite, and 3 medications with overlapping effects. That person may need a completely different conversation, the same number, completely different implications, and right now, that nuance is not making it into enough exam rooms. It's not being said clearly enough. And people are paying for that silence with falls they didn't have to take, and confusion they didn't have to feel, and hospital visits that should never have happened. Let me tell you what actually happens in the body when blood sugar drops too low, because I want you to understand this, not just as a fact, but as something real, something that will help you connect what you're feeling to what might actually be going on. The brain runs on glucose, almost entirely. Unlike muscle, which can switch to burning fat, the brain is heavily dependent on glucose to function. When blood sugar falls, the brain is one of the first places to feel it. In a younger adult, the body's alarm system responds quickly. You feel the shake, the sweat, the racing heart. Those symptoms are the alarm bells firing. They are the body screaming at you to eat something. In older adults, those alarm bells can be quieter or slower, or sometimes they ring in a completely different way. Not as the classic symptoms you'd recognize, but as something subtler, harder to name, confusion that comes on gradually, weakness that settles into the legs, a strange, drifting feeling like you're slightly outside yourself, blurred thinking, blurred vision, a kind of heaviness that doesn't quite make sense given what you've done that day. And because those symptoms don't look like low blood sugar, because they look more like tiredness or stress or just a hard day, they go unrecognized. People push through, they rest, they wait, they assume it'll pass, and sometimes it does pass. Eventually, after the body slowly stabilizes on its own, or after they eat something without really knowing why they felt better. But sometimes it doesn't pass quickly enough, and that's when the fall happens. That's when someone doesn't make it to the bathroom in the night. That's when the confusion is bad enough that something goes wrong. That's when the paramedics get called and everyone is shocked because his numbers were so good. She was doing everything right. Let me give you a longer list because I want you to be able to recognize this, whether it's happening to you or to someone you love. Signs that blood sugar may be running too low, especially in seniors, feeling significantly worse when a meal is delayed even slightly. Not just hungry, wrong, shaky and wrong, waking up tired in a way that doesn't improve. Not the tiredness that fades after coffee, the tiredness that's there before you even open your eyes and stays through the morning. Waking up sweaty when the room isn't hot. Sudden weakness in the legs, not pain, not stiffness, weakness. The kind where your legs just don't feel reliable, feeling off but being unable to describe how. Just off, just not yourself. And it happens at roughly the same time of day, often late morning or late afternoon, often when medication is peaking and a meal hasn't happened yet. Irritability that appears out of nowhere, a sharpness, an impatience. And then after eating, it lifts like it was never there. Episodes of confusion or difficulty concentrating that come and go. Needing something sweet to feel normal again. Reaching for juice or candy not out of craving, but out of something that feels more like necessity. Feeling afraid to go too far from home without food. Carrying snacks not for preference, but for safety. If you are nodding right now, please keep watching, because the next part is the part that I think will change how you see this. Here is what I want you to consider. What if what you've been calling aging isn't entirely aging? What if some of what feels like getting weaker is actually something else? I've sat with patients, people in their 70s who came in convinced they were declining, worried about dementia, worried about their legs giving out, worried that they were just falling apart the way old things fall apart. And when we looked closely, when we looked at the pattern of their symptoms and matched it to the pattern of their medication schedule and their eating schedule and their blood sugar readings, what we found was not irreversible decline. What we found was repeated, unrecognized low blood sugar episodes, happening regularly, multiple times a week, sometimes daily. And when we adjusted the approach, when we loosened the target slightly, or adjusted the medication timing, or made a change that stopped pushing the blood sugar quite so hard, people felt better. Not slightly better, noticeably better, sometimes dramatically better. The weakness improved, the morning fog lifted, the shakiness between meals mostly stopped, because it was never age. It was over-treatment. It was the medication doing its job too well for the body it was living in. I can't tell you how many times I've seen this, and I can't tell you how many times those people had been told, your labs look good, keep doing what you're doing, while their quality of life quietly deteriorated. The number looked good, the person didn't. So what do you do with this? You start paying attention differently. You stop looking only at the number, and you start looking at the number alongside how you feel. Both things, together, as a pair. Here is something simple you can do right now, at home, this week. Get a notebook, or use your phone, whatever is easiest. For 7 days, I want you to track 4 things. First, your blood sugar reading, fasting in the morning, before meals if you can. And whenever you feel off, even if it's not a scheduled check time, check the number in that moment and write it down. Second, how you feel, right next to the number. Not just fine or okay, be specific. Weak, foggy, shaky, normal, good, tired, write it down. Third, what medications you took and when. Fourth, when you last ate and roughly how much. 7 days of that. And patterns will emerge. You may start to see that the weakness always appears around 10:30 a.m., right after your medication peaks and before lunch. You may see that the foggy mornings happen on days when dinner was small and the nighttime went long without food. You may see that your blood sugar reading in those moments is lower than you expected, or you may see something completely different, but you'll see something. And that something gives you real information you can bring to your doctor, information that starts a better conversation. Speaking of conversations with your doctor, I want to help you have a different one, a more specific one. Because most appointments go like this. The doctor pulls up the numbers, nods, says things look good, adjusts a prescription if needed, and moves on. There's not always time to go deeper, and if you don't push, the deeper conversation doesn't happen. So here are the questions I want you to push for. First, given my age, my medications, and my overall health, what blood sugar range is actually safest for me specifically? Not for adults in general, for me. Right now, at this age, with this medication list. Second, am I at risk of low blood sugar episodes, especially overnight, especially between meals when medication is peaking? Third, and this one matters most, could my shakiness, my weakness, my brain fog, or my falls be connected to my blood sugar going too low? Could any of what I'm experiencing be a sign of overtreatment? That third question, that one changes the whole appointment because it reframes the problem. Instead of what's wrong with me that I feel this way, you're asking what is the treatment doing to me that makes me feel this way? Those are very different questions and they lead to very different answers. If you want to go one step further, ask about your A1C target too. Ask, is the A1C goal we're chasing right for my age? Or is there a more appropriate target given where I am in life? That question alone can open a conversation that genuinely changes things. I've been in medicine long enough to know something uncomfortable, and the system rewards numbers, labs that fall in range, a 1C that hits a target, fasting glucose that looks textbook. These things get checked off. They look like success. They document well. What doesn't document as easily is how someone is actually living. Whether they feel strong enough to cook dinner, whether they can walk to the mailbox without their legs feeling unreliable, whether they wake up each morning feeling reasonably like themselves, or whether they drag through the first half of the day in a fog that they've just accepted as the new normal. Those things don't show up in a blood draw, but they are the whole point. You are not a lab report. You're a person who lives in a real body, in a real home, walking to a real bathroom in the dark at 2 a.m. And the target that's printed on your chart needs to serve that person, not an abstract version of a diabetic adult. You, when a number that looks perfect on paper makes your mornings harder and your legs less steady and your mind a little slower and your life a little smaller. That number is not helping you. It is just looking good on a chart while you quietly pay the price. Let me pull everything together because I want this to be clear before you close out of this video. Aiming for a fasting blood sugar of 90 is not automatically the right goal for every senior. Lower is not always safer after a certain age. The same target that protects a 48-year-old can cause real harm in a 75-year-old. Not because of anything that person did wrong, but because the body changes, the risk profile changes. and the target needs to change with it. Overtreatment is real, it happens quietly, and its symptoms, shakiness, weakness, foggy thinking, confusion, fatigue, falls, are easily mistaken for aging itself. The real goal is not the lowest possible blood sugar. The real goal is stable, safe, individualized. A blood sugar that is slightly higher but consistent and steady is often far safer for an older adult than an impressively low number that comes with crashes, falls, and daily episodes of feeling wrong in a body that should feel better than this. Tracking your numbers and your symptoms together is one of the most powerful things you can do. The pattern they form together tells a story that neither one tells alone, and the conversation you have with your doctor should be about your target, not the generic one printed in the guideline. So here's your plan for this week. 3 steps, that's all. Step 1, start the log. 7 days. Blood sugar, symptoms, medications, meals. Keep it simple. Keep it consistent. Step 2, watch for patterns, especially in the mornings, especially in the late morning window when medication peaks, especially on days when meals were smaller or later or skipped. Look at when you feel off and look at what the number says in that moment. Step 3, bring the log to your next appointment, not just the average blood sugar, the whole picture, how you felt, when you felt it, what the number was. And then ask those questions I gave you. Is this target right for me at my age? Could what I'm feeling be related to going too low? Can we look at my medications with fresh eyes? That's it. 3 steps. And those 3 steps might start a conversation that changes everything. Now, I want to hear from you. What is your fasting blood sugar usually in the morning? Have you ever felt shaky or dizzy even though your number looked completely fine? Have you ever been told everything looks great while your body was quietly telling you a completely different story? Leave your answer in the comments, because you're not alone in this. And the more we talk about it, the more people share what their actual experience has been, not just what the numbers say, the better chance we have of making sure this information reaches someone who really needs it. If you have a parent, a spouse, a sibling, a neighbor over 65 managing diabetes, please share this video with them, not to alarm them, but because they deserve to know this. They deserve to ask these questions. They deserve a target that was built for their body. Next week, I'll be covering something closely related. The hidden signs that your diabetes medication may actually be too strong for where your body is right now. Signs most people are missing entirely. You won't want to miss that one. Before I go, a note I always feel is important to say clearly. Everything in this video is educational information. It is not personal medical advice. It is not a directive to change your medications or ignore your doctor's guidance. Blood sugar targets vary depending on your specific medications, your kidney function, your history, your frailty level, your other diagnoses, through 100 other factors that only your clinician can fully assess. What I want this video to do is give you the information and the language to have a better conversation with your clinician, a more specific one, a more honest one. You deserve that conversation. Go have it.